Good evening, everyone. My name is Meg Wheeler. I'm a candidate for the Massachusetts State Senate in the Plymouth and Norfolk District, and I'm here tonight to give you another update on COVID-19. So before I dive in and do that, I do just want to say, as many of you may be aware, today is the 7th anniversary of the Boston Marathon bombing. Obviously, that was an incredibly difficult and heartbreaking time for the city of Boston and for communities all over Massachusetts. And so today, especially, but of course all days, I am sending my support and my thoughts to the families who lost loved ones in that incredibly tragic bombing and the subsequent police efforts afterwards to catch the bombers. Today, I do want to give you an update as well on the COVID-19 situation. So I will start with the numbers, as I always do. In terms of total tests, we have now in the state of Massachusetts tested over 132,000 people. That's an additional 5,472 tests today alone. In terms of positive cases, we're now at 29,918. That's an increase of 1,755 from yesterday. Easter Sunday, just a few days ago, saw the biggest single day increase in positive COVID-19 cases in Massachusetts. We saw over 2,600 new cases on Easter Sunday alone. In terms of fatalities from COVID-19, unfortunately, we have now surpassed 1,000 deaths in the state of Massachusetts. The total is now at 1,108. That's up 151 since yesterday. So as my recollection serves, I believe this is the largest increase that we've seen so far, very sadly. In the United States, there are now over 601,000 positive COVID-19 cases with over 24,000 deaths. I do want to always put some positive news out there if I can. Across the United States, over 43,000 people have recovered from COVID-19. We are not here providing recovery numbers for Massachusetts because as far as we've been able to ascertain, they're not published. But certainly if we can continue to get the recovery numbers, we will state them here as well. So I do want to also note that the state, as of today, has started to report the number of cases on a town-by-town basis. Previously, the state said that it was up to each town to publish this information. Now the state is going to be doing it for all towns in the Commonwealth. You can find this on their website, mass.gov, and it'll be updated every Wednesday. So I know here in the district, I believe we're ranging everywhere from 14 cases in towns like Cohasset and Hull, up to, I believe it was 267 in Marshfield. So we obviously do have positive cases here on the South Shore, and and that information is available to you if you'd like to see the breakdown by town. A few updates for you at the state level. So first, let's talk about the PPE. So this is the personal protective equipment that's provided to healthcare workers, to frontline responders as we're battling COVID-19. So the state received 200 ventilators from FEMA on Monday. Governor Baker said that the ventilators are being tested and they will be distributed to hospitals and healthcare workers over the next few days. We are also expecting 1 million pieces of PPE from the federal government, 650,000 masks and 250,000 suits. Excuse me, and those are expected to arrive in the next few days. As you may recall from last week, a significant amount of PPE was flown in by the Patriots plane from China. Another portion of the gear from that plane arrived in Boston last night, is currently being inspected before it will be distributed. But again, hopefully that will happen this week. Massachusetts is calling on local manufacturers to step up and produce PPE in the fight against coronavirus. So Governor Baker on Monday praised the Manufacturing Emergency Response Team, MERT, which has been working with manufacturers to help them pivot operations so that they can produce masks and gowns and sanitizers and thermometers and all of the different tools that our health care system needs right now. The Commonwealth has already heard from over 400 manufacturers who have said that they're willing to partake in these efforts, and at this point, $10 million has been set aside now for the creation of that PPE. So on the hospital front, about half of all of the hospital beds in Massachusetts are now occupied. Governor Baker expects that that the middle of April into the end of April is really when we're going to see the worst surge there. So originally the surge was expected, I believe it was actually this April 7th through the 17th, then it was pushed the 10th through the 20th. Now experts are predicting that the surge will occur between the 20th and the 30th of April. So we are by no means out of the woods yet, and we absolutely need to continue to take social distancing measures very seriously. On the economic front, a couple of updates there. So Massachusetts has joined a coalition of 6 other Northeast states, excuse me, who are working together to create joint recommendations on how they can reopen the economies in the aftermath of all of this. I think it's important that we're doing this with other states around us, because as you can imagine, if one state decided to open but the others didn't necessarily, that could have long-lasting impacts. And so it's really important that together we come up with a solid plan here. The coalition of governors emphasized that economic and healthcare needs need to be considered on an equal basis, but that ultimately healthcare recovery absolutely comes first. Their goal is to have a recommendation in the next few weeks. Across the country, the governors of California, Oregon, and Washington announced a similar initiative to restart their economies on the West Coast. So good news. Excuse me. And one other update on that actually as well, while we're talking about the economy. So we have just announced that we will be hosting a virtual town hall on restoring and recovering our economy. That will be next Thursday. I believe that's April 23rd. Sorry, that's not right. April 25th. I'll get you the date. No, April 23rd. Okay, so that'll be April 23rd at 7:30 p.m. On Facebook. So live on Facebook and Instagram, live on YouTube, and then live on our website, megwheeler.com. So we will be doing that. We'll be talking about some of the things that need to happen in order to restore our economy. We'll have some special guests on, hopefully, and you'll get to hear more on my plans for what I will do when I'm in the state Senate to help our economy rebound after COVID-19. Just one more update on the state level specifically. So the governor also announced that hazard pay is coming to many Massachusetts healthcare workers. This is something that a lot of people have been fighting for and been very vocal about asking for the last few weeks, especially. So AFSCME, which is the union that represents licensed nurses and caregivers working in Massachusetts state hospitals and group homes, came to a deal on Sunday night with the state to increase pay by as much as $10 an hour for the duration of this health emergency. So this hazard pay will kick in immediately, and it'll last through at least May 30th, if not longer. Workers holding a license related to their occupation, so licensed practical nurse, for example, would receive a $10 per hour increase in their wages, while all other workers will receive a $5 per hour bump in their wages. The state also agreed to offer a one-time $500 bonus to eligible workers who have not missed a shift or regular workday since the state of emergency was declared, which happened on May 10th. So some good news coming to our workers. I still argue that it's probably not enough, but at least we're seeing some movement on that and getting them some of the help that they need. We do have some updates out of the State House as well. So housing legislation has been really the big thing that has been discussed over the last few weeks. Both the House and the Senate each passed their own bills on some version of foreclosures and rent moratoriums, and it was really just a question of if the two sides would come together and what a final deal would look like. So last Wednesday, so a week ago, the House accepted the House accepted a conference committee report on COVID-19 housing stability bill. So basically 4 of the 6 negotiators were able to strike a deal on the bill's language. Now, again, both the House and the Senate had passed their own bills, but one of the things that they were unable to agree on was the language on exactly how the moratorium would work. So in theory, both the House and the Senate were in favor of support for folks to not have to worry about their mortgages or their rent right now, but unclear on some of the details. So the legislature set up a conference committee, which is essentially what they do when they are unable to actually informally work out disagreement. So they set up this conference committee They're negotiating remotely, and it sounds like there may be some terms that they've come to. So the new version of this legislation would establish a moratorium on evictions and foreclosures during the governor's COVID-19 emergency declaration, which is, of course, good news. There is also a new coronavirus aid bill in the House, the Massachusetts House. So Monday night, they held a virtual public hearing on this new legislation designed to provide short-term economic relief for families, especially those who are in poverty or have vulnerable children or people with disabilities. This relief would come in the form of a one-time additional benefit to those who already receive help through the state's transitional aid to families with dependent children program. And the cost of this one-time infusion is being estimated at about $17 million. So this bill would actually set aside $6 million for a one-time additional benefit under the state's program for emergency aid to the elderly, disabled, and children. So potentially some good news. I think this helps our most vulnerable populations, and we'll of course be tracking this to see what actually happens with it. There is a new bill in the House which would require assisted living residences, elderly housing facilities, and long-term care facilities to file daily reports on COVID-19. This, of course, is in response to a couple of things. One, the fact that such a large number of cases and deaths from COVID-19 are happening in care homes, and two, because of concerns over an incredibly high number of deaths in some of the veterans' homes that we've been talking about before. So a virtual hearing is planned for tomorrow on this bill. And essentially, facilities would have to file daily reports with the public health officials on the number of cases from COVID-19 and the number of deaths, and it would in theory, allow the state to have some sort of oversight and be able to jump on issues perhaps sooner than they have in the past. So that's basically it for the update today. I know, especially here on the South Shore, the last couple of days have been tough with power outages for many of us. We had them here in Cohasset. I know many other towns were affected by this as well. So on top of all the COVID-19 stuff, you may have been dealing with that as well. As always, you can reach us if there's anything at all that you need. You can reach us at hello@megwheeler.com. Our campaign line is 781-724-3461. You can DM us on any of the social media platforms. And we do have our COVID resource page, which is megwheeler.com/COVID, where we provide daily updates and are keeping the resource list there updated regularly as well. So, okay, so I'm going to, in terms of questions, I actually have to run to another thing today. So I see a couple of questions in here. I'm going to answer, so again, I want to remind everyone, we're going to have a virtual town hall next Thursday, April 23rd at 7:30 p.m. on Facebook, Instagram, YouTube, and our website, megwheeler.com, talking all about how to restore our economy. So I'm going to answer questions at that town hall on no matter who you are, whether you are an hourly wage worker, whether you are a small business owner, whether you invest in the stock market, whatever it may be, you've got a retirement account you're worried about. We're going to talk about all of the people who have been impacted by COVID-19 and the steps that we can take to restore our economy. So I will save some of those questions for then, just so that we can kind of deal with them all in that one space. And I will be back here tomorrow night at 7:30 p.m. Tonight was a little bit earlier because of this meeting I have to run to, but I will be back here tomorrow night at 7:30 p.m. I'm here every weeknight at 7:30 p.m. providing an update on COVID-19, and we'll continue to do that for as long as I'm able to and as long as we are dealing with the situation. So in the meantime, I hope everyone is staying safe and healthy. As always, I just want to give an incredible shout out and thanks to everyone who is out there fighting on the front lines for us to ensure that we get through this as best as we can. Everyone from our doctors and nurses and hospital workers to the people in our grocery stores and our coffee shops and our gas stations and the post office. We need to especially support the post office right now as they're taking incredible criticism from certain parts of our government. But everyone who is out there ensuring that we get the resources that we need to get through this. I am incredibly grateful for all that you do, and I will continue to fight for you when I am in the state Senate to ensure that you have fair, reasonable pay that allows you to take care of your family, that you have access to the benefits that you need and deserve, and that that you are no longer struggling when you are working in your job, because that's just not acceptable. So thank you again for all that you do, and for everyone else, please stay safe and stay healthy, and we are here if you need us. Good night.